Hi, I'm Rochelle Corrado. I'm an internal medicine and obesity medicine physician, and I'm here today to help you learn how to start the really sensitive conversation about weight with your patients. We are going to help you learn about using 6 A's to help figure out how to have compassionate, empathetic conversations about their weight and how to counsel them on ways to move forward. Asking is so important when we're having any conversation with a patient that is sensitive, and particularly for patients who are struggling with their weight, that can be an incredibly sensitive topic for them. So it's always important to ask permission to invite them to participate in the conversation. Patrice, thanks so much for coming in today. I know from some of the health parameters that we talked about, things from blood sugar, blood pressure going kind of maybe the direction we weren't wanting. Would you be open to talking about how your weight might be impacting some of those health parameters and how we can work together as a team to shift those to a more optimal health range?
Sure. I feel like my weight is affecting my confidence, which is giving me some stress as well, in addition to me not knowing what I can do at this juncture to try to control my eating habits. That's stressful.
Yeah, thank you for that. One of the things as we're evaluating our patients is really taking all of the information about that patient to determine how their weight might be impacting their health. Utilizing your vital signs, your lab results, your physical exam findings, and your other health parameters to determine how their weight is impacting their health, so you can have the best idea as to how to move forward with them in the future. So if it's okay with you, I think a couple of things I would love to do is gather more information so we can kind of look at all the pieces that might be contributing to your weight. So that might include checking your vital signs, getting your blood pressure, heart rate, checking your weight, checking your waist circumference, and even doing a body composition test if you're open to that. So I know we've talked about a lot of parameters today in terms of little tweaks they can make for the lifestyle adjustments. Would you mind telling me a little bit about kind of eating habits lately? What do you feel like has changed between the last 3 months? Whether it's more stress eating or times of the day or the foods in which you're eating, if you can tell me a little bit about that.
I'm definitely stress eating. I'm snacking more because I'm studying. Okay. I'm definitely eating more sugar now. And if you recall, I didn't usually really eat sugar. I stayed away from sugar.
Kind of thinking about and brainstorming, what are the barriers and how can we make little tweaks and adjustments that we can work on between now and our next appointment? One of the important parts of any weight management journey is helping people understand the impacts that this will have on their health. So oftentimes losing upwards of 5 to 10% of your total body weight can help improve health parameters such as preventing progression to diabetes or even improving blood sugar and blood pressure, even reducing potentially cardiovascular disease in the future. One of the important things and part of the AVISE process is also individualizing care for the person in front of you, helping them recognize that you're there for their journey and going to help them with all the pitfalls and barriers that they may face along the way. So thank you for sharing all that with me. I think one of the things, since we've been working on these things now for a couple months, and I know it's been frustrating that you haven't, found as much success as you would hope. I think that's really common, right? Sometimes we can do all the right things and our biology really wants to hold on to and store calories. And I think for you, given your family history, also too for diabetes and so forth, like you probably have genes that play a role in your body's desire to want to hold on to and store calories. That also makes it harder despite all your best efforts. Okay. So I think understanding that sometimes we need medications to kind of work in the parts of the brain that are driving our body to want to hold on to and store calories. Those meds sometimes will help to decrease hunger, they will decrease cravings, they will make it feel so you're full sooner. I can certainly show you some examples if you'd like and kind of walk you through what that would look like and side effects. I do favor for you potentially trying one of the injectable drugs, largely because given your lab parameters and kind of some of the other medications in which you're on, I think those would be the ones that would help your lab and health the most, while also not kind of, working against some of the other medications that you have or causing you harm in other realms, if that makes sense.
That makes sense. That's an option.
First, your patient has to feel confident and comfortable with the plan that you guys have arranged. Making sure that they don't have any questions or concerns before they leave your office is important. Also, setting them out with some actionable items using SMART goals to determine what are small, meaningful changes that they can start to work on before your next appointment. I like to pick 2 big things that I think maybe that we could work on until our next appointment. What do you feel like might be the easiest avenue? And we can talk about what that might look like.
The easiest might be activity because I can't guarantee sleep right now.
So how do you think we get you outdoors just for like a walk or even a 5-minute walk? Is there a certain time of day where you feel like you might be more inclined to do that, like after dinner or after lunch?
Maybe in the mornings.
Okay. How long do you feel like you want to walk for?
maybe 30 minutes.
30 minutes. Okay. So we're going to commit to 30-minute walk one morning. What day of the week do you feel like would be the easiest for you to achieve that?
Tuesday.
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 Okay. Take the time to fill out prior authorizations for your patients for the medications that might be necessary as part of this weight journey for them. Take the time to help your team set up follow-up with you in a timely manner so you can talk about whether or not they're experiencing side effects and how you could best mitigate those. So I know we agreed and kind of talked through all your options and thinking that semaglutide might be the best option to start moving forward. I'm going to first send the prior authorization to your insurance. And then the next step is I'm going to send that to your pharmacy so that you can pick it up. And remember, we're going to try to start it on a day when you have nothing going on the next day, so that if you feel more of those side effects and symptoms, you can be at home relaxed in your own home environment.
That makes sense. Okay.
One of the other things is that I want to get you a follow-up appointment with me roughly in like 4 weeks, just to touch base, see how things are going.
Okay.
But you can message me in the patient portal. Certainly if you're not tolerating anything or experiencing some side effects that we didn't talk about, please let me know.
Okay, absolutely.
Let them know what other support services that you have available within your health system, whether or not that's registered dietitians, exercise physiologists, or even health psychologists. So I got the prior authorization approved. I put in your medicine. Let's arrange follow-up with me, and then also let's arrange follow-up the other health support team, right? So I know I told you in the past about the exercise physiologist. I know you've been trying to think of other ways in which we could build some more physical activity. And what do you think about meeting up with him to see if you can get some other ideas for moving forward to help make tweaks?
Well, it can get from 1% to 10%. I'm all for it.
Okay, great. I'll help arrange that for you.
Thank you.
Thank you for coming in again today.
Thanks to Sammy.
And lastly, make sure that patients understand that you are part of this process with them. You are on this journey with them and are a supportive team member at this whole entire journey.